Like I said, I don't know what I'd do without them, really.
Tino Van Dyke lost his vision completely in 2020 and was diagnosed with cancer soon after. He lives at Holway House, where he receives help with daily appointments, transportation, groceries, just about anything he can no longer do himself.
If I had become blind maybe earlier, maybe 20 years ago, I might have been more attuned to it. But at my age, I need someone to go out with me.
Now he's afraid and at risk of losing those vital services. Van Dyke is one of 400 seniors in Metro Vancouver and Victoria who depend on Holway House's Seniors Enhanced Independent Living program, a pilot program that for the past 3 years has received surplus funding from BC Housing. That funding no longer available.
So currently we're operating off of savings, which we can't, and it's not sustainable.
In a statement, BC Housing says the organization received one-time funding and was notified in March the program would not be renewed, adding it's working on finding alternatives to keep support for seniors going. BC Seniors Advocate says BC Housing typically funds structures, not services.
They don't really get into health or social services. That's other ministries. And that's why our office has been calling on a cross-ministerial plan.
How do we stop the gap so that seniors aren't slipping through the cracks and falling into homelessness or having to go into long-term care when they don't need to?
Due to the funding constraints, the outreach program is running in fewer neighborhoods. Conkin believes greater investment in services like this will save the province money and provide dignity for seniors.
This program costs around $1,000 per senior per year. That's under $3 per person per day. When we look at hospitalization, we're looking at over $1,600 per day. Assisted living and long-term care, we're looking at $400 to $600 per person per day.
The latest Greater Vancouver homeless count shows nearly 1 in 4 unhoused British Columbians is a senior. And nearly half of those seniors experience homelessness for the first time after turning 55. For Van Dyke, the program has been a lifeline. Holway House hopes funding is restored so they can expand the program across BC.